Is function clear about alpha 2? Decrease release of norepinephrine and decrease release of insulin because present on beta. Okay. Okay, now we come to our main topic. Any problem till here in this synapse? No problem, yeah? Okay. The other drugs, anyone know about cocaine? Everyone know about cocaine. Cocaine is a drug of abuse, yeah? Cocaine. Cocaine also reuptake inhibitor. Reuptake inhibitor of norepinephrine. Cocaine can induce heart attack easily. Fast, dangerous. Cocaine. Reuptake inhibitor. Ephedrine. Dope test for athletic, for football players. Before the sportsmen, they need to perform dope test. Dope test. Some sportsmen they're using drugs for their increased performance in during the match. Using this ephedrine, it's a drug of abuse. Ephedrine, pseudoephedrine, ephedrine, pseudoephedrine. It's also increase reuptake inhibitors. Also increase epinephrine or epinephrine. Okay. Also increase epinephrine. Also increase norepinephrine. So, if ephedrine, pseudoephedrine increase heart rate and increase heart activity, muscle blood supply increase. This ephedrine, pseudoephedrine also increase CNS activity. The person become well, feeling well and good and perform more good. So before start of match, they're using these drugs just to increase their performance in match. Understand? So dope test we perform for this type of drugs. Understand? Ephedrine, pseudoephedrine. Now come to receptor now. Alpha 1, alpha 2. What is the location of alpha 1? Alpha 1 present on skin vessels. Okay. Alpha 1 present on abdominal vessels. All GLT vessels. Okay. For the function of alpha 1. Alpha 1 vasoconstriction. Alpha 1 for vasoconstriction. Okay. So if you stimulate alpha 1, what happens? If you stimulate alpha 1 vasoconstriction, resistance increase, blood pressure increase blood pressure. Okay. Alpha 1 increase blood pressure, vasoconstriction, resistance increase, blood pressure increase. Alpha 2 where present? Already done. Presynaptic membrane. What function? Decrease the release of norepinephrine. It also present on presynaptic membrane of sympathetic parasympathetic system. Okay. Alpha 2. Decrease the release of acetylcholine. Third one, decrease the release of insulin. These three function for alpha 2. Next one, beta 1. Beta 1 present there on cardiac tissue. M3 present where? Node. Yeah. Beta 1 present on cardiac tissue where? Full. Beta 1 present on full heart. Also on node. Also on conductive system. also on muscle. Beta 1 present all over the heart. Beta 1 present all over the heart. All over the heart increase heart rate, increase contraction of the heart, force of contraction rate, all increases. Okay, beta 1. Beta 1 present in kidney. Beta 1 present in kidney. Where? Renin releasing cell. Beta 1 help to release renin. Okay, beta 1 help to release renin. Understand? Beta 1 present on heart. Beta 1 present on kidney. In the kidney part, renin release. Beta 1 present on ciliary body. What is the location of ciliary body? This will come in eye. Ciliary body doing what? Aqueous humor. Yeah? Production of aqueous humor. So beta 1. Beta 1 produce aqueous humor. Stimulate ciliary body to is good for glaucoma if you stimulate beta 1? No. Understand? If you stimulate beta 1, it's not good for glaucoma. If you stimulate alpha 1, it's not good for glaucoma. It means sympathetic system agonist not good for glaucoma. Contraindicated. Done? So if you block beta 1, that's good for glaucoma? Yes.
Yes.
Why? Because ecosystem production decrease, yeah?
Yes.
So we use beta blocker. We use beta blocker for glaucoma. Beta 1 blocker for glaucoma. Okay. Pilocarpine for glaucoma. M3 receptor agonist. Understand? Can we apply atropine for glaucoma?
No.
Atropine for glaucoma? No, because close the angle. It's not good for glaucoma. Okay. Done? How about tropicamide? Just for eye exam, not used for glaucoma. Okay. Beta 1 done. Beta 2. Beta 2 receptor vessels of skeletal muscle. Vessels of skeletal muscles. Okay. Beta 2. Beta 2 doing what? Vasodilation. With too much stimulation of beta 2, then blood pressure can be okay. For alpha 1, blood pressure increase. For beta 2, blood pressure decrease. Vessels of muscle. Beta 2 receptor present on alpha cell. Where alpha cell? Pancreas, yeah. Alpha, beta, delta. Beta receptor on alpha cell, alpha receptor on beta cell. Done. Opposite. Alpha receptor on beta cell, beta receptor on alpha cell. Done. The beta 2. Beta receptor on alpha cell. So alpha cell producing what? Glucagon, yeah? Glucagon. Alpha 1 producing alpha cell producing what? Glucagon. So if you stimulate alpha cell by using which receptor? Beta 2 receptor. Yeah. Okay. If patient having diabetes and you want patient also hypertensive, you want to use beta blocker. What happens with sugar level?
Increase.
Why the beta blocker? If you block beta,
Decrease.
glucagon, glucagon increase glucose. Yeah, glucagon doing what? Increase glucose. Understand? So sympathetic system doing what in your body? Sympathetic system decrease insulin. Yeah,
Yes,
alpha
sir.
which receptor? Alpha 2 receptor. Yeah, sympathetic system decrease insulin. Sympathetic system increase glucagon. What is the net result here? Sympathetic system increase your blood glucose level. Understand? And when sympathetic system excited, blood glucose level increase. Clear? Because increase glucagon, what happened here? Decrease insulin. Understand? So decrease
Yeah.
insulin, increase glucose. The function of insulin to decrease the glucose. But here insulin already decreasing. Yeah. So insulin was not able to decrease the glucose. Glucagon here increasing. So if you stimulate beta 2, glucagon will increase. This will increase the glucose level. Understand? So it's a beta 2 receptor. Beta 2 receptor. Now another very important use. Beta 2 receptor present on bronchioles, where respiratory system in bronchiole. Beta 2 receptor drug. What done with beta 2 receptor on smooth muscle of bronchioles, causing bronchodilation. Bronchodilation. So it's good for asthma patient, I think. Bronchodilation is good for asthma patient, yeah.
Yeah.
Uh, Physostigmine, rivastigmine, neostigmine, pilocarpine, methanicol, carcapol. This was done in cholinergic agonist. Cholinergic agonist drug you must avoid in asthma patient. Why? Because parasympathetic system causing bronchoconstriction. Yeah, this was done in the first group of drugs. Yeah. So parasympathetic antagonist we use. You know ipratropium last lecture. Ipratropium, tiotropium. Yeah. Ipratropium, tiotropium, very good for asthma. Why good for asthma? Because they block M3. What is the function of M3? M3 in respiratory system bronchoconstriction. Okay, M3 in respiratory system causing bronchoconstriction. So if you block M3, is good for asthma. Done. Okay, now come on sympathetic system. Sympathetic system beta 2 receptor on bronchioles causing bronchodilation. So now you tell me, patient having asthma also come to you having diabetes and having hypertension. You want to use beta blocker. You must take care of asthma. If you want to use beta blocker in asthma patient, yeah, patient having any cardiac issue, hypertension, angina, MI, and patient also having asthma, must take care about asthma if you want to use beta blocker. Understand? If you block this beta 2, what happens? No more bronchodilation. Yeah, asthma getting worse. Asthma getting worse. Understand? Beta 2 causing bronchodilation. Beta 2 causing bronchodilation. Vessels of skeletal muscles, alpha cells of pancreas, also on respiratory bronchioles. Okay. Beta 3. Beta 3 present on lipids. This for lipolysis. Beta 3 is not much important. You can forget about this. Lipolysis. Just for lipolysis. Okay. It's not much important function. No drug acting on this. Beta 1, beta 2. We need just these four receptors. Clear? Just need these four receptors. Alpha 1. Alpha 1 in eye doing what? Iris having alpha 1, yeah? In eye.
Production.
No. That was beta 1. Alpha 1 causing mydriasis. Okay? Alpha 1 in eye causing mydriasis. Dilate the pupil. Can you use drug for alpha 1 to examine the eye? Of course you can use. Yeah? It also dilate the eye. Yeah? So you can see inside structure. Mydriasis. Alpha 1 causing vasoconstriction. Vasoconstriction. Increase blood pressure. Okay? Alpha 1 present another location, sphincter. Which sphincter? Gastric sphincter, pyloric sphincter, gastro anal sphincter, and urinary sphincter. Yeah, at the bladder, at the sphincter. So it's a sphincter alpha one. Alpha one. If you stimulate alpha one, sphincter close. If you stimulate alpha one, then sphincter close. Yeah. The alpha one can cause alpha one present where is a bladder here. Bladder having two sphincter. It's the internal, another external. This internal sphincter having alpha 1. So if you contract the smooth muscle here, what happens? Close. So can you do micturition? No. Urinary retention. Urinary retention. Okay. Alpha 1. Urinary retention. Sphincter. The sphincter of intestine, like here, stomach sphincter, this sphincter, ileocecal valve, anatomy, yeah, all GIT sphincter, also close. Close all sphincter can induce constipation. Sympathetic system, close all sphincter, okay? Sphincter, gastric sphincter, ileocecal sphincter, anal, involuntary anal sphincter, involuntary urinary sphincter, okay? It can lead to constipation because sphincter closed. Resonance sphincter. These are the three main effects of alpha 1. Alpha 1 in eye, alpha 1 causing vasoconstriction. Okay. Which vessel vasoconstriction? Abdominal vessel, especially. Abdominal vessel and skin vessel. Abdominal vessels and skin vessels. Okay. And alpha 2 function, decrease release of epinephrine, decrease release of insulin. Just these two functions keep in mind. Okay. Decrease release of norepinephrine, decrease release of beta 1 function present on heart, present in eye. In eye, doing what? Production of ecosystem. Yeah? Beta 1 in eye, where? Ciliary, ciliary body. Ciliary body produce ecosystem. So ecosystem, eye. One function. Production of ecosystem. Beta 1 function in heart rate increase. Yeah? Beta 1 function in kidney, renin increase. Renin for RAS system, okay? Renin for RAS system, renin angiotensin aldosterone system to control blood pressure. Second one, there beta 2. Beta 2 doing what? Vasodilation. If vasodilation, it can decrease blood pressure, okay? Done? It can decrease blood pressure. It's causing bronchodilation. What? Bronchodilation. Causing bronchodilation. Beta 2 present on alpha cell. Increase the release of glucagon. Increase the release of glucagon. So, if the glucagon increase, it leads to increased level of glucose. Glucose will increase, okay? So, increasing your glucose level. Understand? Vasodilation, decrease blood pressure. Bronchodilation is very good for asthma patient, yeah? for asthma patient, bronchodilation. We need bronchodilation there. We're using ipratropium drug. We're using drug for beta 2 inhaler. Okay, we use for asthma patient. Let we discuss the drug name. Okay, the function of these is after clear.
Sir.
Clear, yeah. Okay, now come to drugs. Epinephrine. Can you use acetylcholine as drug from outside?
No.
No.
But you can use epinephrine or epinephrine. Okay, why not? Because in blood we having pseudocholinesterase enzyme. Okay, it can break down of acetylcholine. But we can apply epinephrine, epinephrine, dopamine. These things we also can apply, but the one thing keep in mind, we can't eat in the form of pills. The GIT, listen here. We just can give injectable, okay? We just can use injection of norepinephrine, injection of dopamine, injection of norepinephrine, epinephrine, okay? We can't give like in the form of tablet form, capsule form. Oral injection is not allowed. Why? The stomach, the intestine, the enzyme here, CUMT. If you eat epinephrine or not epinephrine, what happens? Can it be absorbed? No, it's a breakdown inside the intestine. Okay, we imagine no breakdown here. When this drug, epinephrine, now absorbs portal system, this drug moves to liver. In the liver, we have an enzyme, monoamine oxidase. Monoamine oxidase. Clear? This monoamine oxidase in liver and CUMT in intestine. Can you take oral epinephrine?
No.
Never use oral. Norepinephrine never be used orally. Dopamine we never use orally. Understand? Why? Because inside the intestine we having CUMT. CUMT, what is the function of CUMT? Breakdown of epinephrine or epinephrine. Clear? And amino enzyme present inside the liver, breakdown. If absorption done, now drug enter to blood. Absorption done. This all the blood from the GIT enter to liver first, yeah? So then breakdown there. So oral route is not preferable. You can't use orally. Only IV, intravenous, you know, venous. Understand?
Yes,
Intravenous.
sir.
Epinephrine, norepinephrine, dopamine, another drug, the glutamine. The glutamine, isoterenol, isoproterenol, terenol. The glutamine, isoproterenol, okay, isoproterenol, glutamine, phenylphene. Later we categorize. I just writing a name just okay. Later we categorize these then more easy. Phenylphene, oxymetazoline, 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 okay. Oxymetazoline, phenylphene, isoproterenol, salmeterol, salmeterol, formoterol, formoterol, formoterol. Oh, very good for beta 2. L-butyrol, L-butyrol. Not mixed with these drugs with like all, O-L-O-L, all. Okay? These are blockers. These are just metirol, from metirol. Okay? Big difference. Not mixed with all. Clear? These are blockers. These are beta blocker. O-L-O-L. Here are salmeterol, formoterol, albuterol, salbutamol, 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 terbutaline, terbutaline. These also for beta 2. These drugs for beta 2, they stimulate beta 2, causing bronchodilation. These all drugs for very easy to understand. Yeah. These are long action. Just need one puff at night or in early in morning. Full day, no attack of asthma. For relief, a quick relief, we need short acting. Terbutaline, salbutamol, L-butyrol. Okay, these are short action. Clear? Phenylpheniramine, oxymetazoline for alpha 1. Phenylpheniramine, oxymetazoline for alpha 1. Mostly having eye uses. Someone I read put one drop of phenylpheniramine in eye, redness finish. Why? Red eye mean having some with relation there, yeah, in sclera. If you put drop of phenylpheniramine or oxymetazoline, what happens? Vasoconstriction, redness finish. Red eye we use. Eye uses, nasal use. Yes, okay. Phenylpheniramine, oxymetazoline. The glutamine for beta 1 also, beta 2 also, and isotretinoin. Okay. How about these drugs? Epinephrine, norepinephrine, dopamine. They can attach with alpha, also can attach with beta, also can attach with dopamine. All receptor, okay? Epinephrine first prefer beta, then also go for alpha, then also go for dopamine. Understand? These three drugs, totally non-selective. They can occupy alpha receptor, occupy beta receptor, occupy dopamine receptor. Understand? Just a preference difference. Dopamine first go for dopamine receptor, then go for alpha receptor, then go for beta receptor. Norepinephrine first go for alpha receptor, then go for beta receptor, then go for dopamine receptor. Also like this, okay? So these drugs they can bind with all receptors. Bind with all receptors. Another drug, one drug, which receptor left? Alpha 2 left, yeah. Selective alpha 2. For alpha 2, we having clonidine. Clonidine, methyl dopa. Clonidine, methyl dopa. These two drugs for alpha 2. Okay? Alpha 2 doing what? Decrease norepinephrine release, yeah? So these two drugs very good for hypertension. These two are only drug belongs to sympathetic agonist used for hypertension. Okay. Clonidine and methyl dopa. This we use in hypertension. Okay, now we summarize. Tomorrow we will discuss one by one. Alpha 1 drug, alpha 2 drugs, beta 2 drug. No drug directly for beta 1, okay? For alpha 1, phenylphrine. For alpha 1, oxymetazoline. For alpha 2, clonidine. For alpha 2, methyl dopa. Methyl dopa. For beta 2, oh, it's for asthma. Metirol. Salmeterol. Okay. Formoterol. Next, L-butyrol. Butyrol. Next, salbutamol. Next, terbutaline. Terbutaline. All these drugs for what purpose? For health. Clear? These two drugs for what purpose? Eye use and nasal congestion. Later I explain in tomorrow lecture. I will explain one by one. Okay. Clonidine for hypertension. Clear? Drug going for alpha, beta, everything. Which drug? Epinephrine, norepinephrine, and dopamine. And dopamine. These three drugs have ability for alpha, also go for beta, also go for dopamine. How about the butamine? The butamine. The butamine and isoproterenol. These two drugs are beta 1 and beta 2. Clear?
Yes, sir.
These two drugs are beta 2. Tomorrow we will learn in detail their uses. Okay? Then,
Okay.
for today class. Any question? Let me know later. Okay? See you inshallah.
Yes, sir.
Yes, sir.
Thank you.
Allah
Thanks
Hafiz.
very much.
Assalamualaikum.
Waalaikumsalam.
Waalaikumsalam.
Syukriya, Syar. Allah Hafiz.
Allah.
Waalaikumsalam. Pesertanya kok alhamdulillah ini.
Apa tadi?
Yang mana yang lain? 13 orang, J.